All right. Hello, all. This is Douglas Bailey, and this is my presentation on high incidence disabilities and its solutions. So we're going to be talking about 5 different high incident disabilities and some solutions that I've provided for those disabilities. All right, so the presentation format that I'm going to use for high incidence disabilities and its solutions is just simply breaking it all down. So the first thing I'm going to do is mention the disability and some background. Then I want to recognize how that disability impacts learners. Then I want to identify solutions and or added benefits. And then I want to show an example of the intervention or the solution to the disability. And then we can take a look at some possible outcomes of listed solutions. Okay, so let's get into this. All right, so the first disability that we're going to talk about is autism, or ASD. Autism is a neurodevelopmental disorder traditionally characterized by trouble with communication and social interactions, according to Martino, 2020. There are 3 levels of autism, also known as autism spectrum disorder. Level 1 is mild. It's also known as high functioning. Those learners require less support. Level 2 is mid-range, which needs consistent and steady support. And then level 3 is the most severe form of autism, and it needs the most significant support. So the question is how does autism affect learners? Well, on a level 1, students or learners may have difficulties transitioning to a new topic, or they may have challenges with planning and organizing routines in schools. And these are listed by the Applied Behavior Analysis Program Guide. On level 2, learners might have difficulties coping with changes in the environment, which can cause them a great deal of distress. Okay, and then on level 3, learners may have a significant verbal and nonverbal communication impairment, and they might also display distress when rituals or routines are disrupted. So the one key word that I think about with autistic learners is transition. All of these levels identify transitional issues or challenges that you may have with learners with autism. So a solution, or one of the solutions that I would add, is possibly adding a visual schedule. So a visual schedule communicates the sequence of upcoming activities or events through the use of objects, photographs, icons, or words. How does this support learners? According to Hume, visual schedules are also an important tool in reducing anxiety in students with ASD while teaching flexibility. Students with autism may feel anxious if the expectations are not understood or if predictable routines are not in place. So by providing this visual schedule, it will definitely cut down on some of the anxiety that an autistic learner may have when transitioning from one activity to the next. There are also some added benefits to visual schedules. Teaching students with autism to follow visual schedules rather than being moved around the classroom or through activities by staff members increases the likelihood that students will become independent of adult delivered prompts. That again is by Hume. So that's great because we want our autistic learners to have a sense of independence. So by utilizing a visual schedule, that is one of the first techniques that we can use. And what you're looking at right now is an actual example of what a visual student schedule would look like. Okay, so you see on the schedule area, you have the students are able to see exactly what's happening. They have lunch, then they have their break, okay, workstation, so they can always look and see exactly what is coming down the pipeline. So learners will be able to communicate with instructors and peers in terms of seeing what their day-to-day activity or activities are. In addition to using a visual schedule or just visual aids, what we're looking at is a GIF of a fan. a learner can point out to exactly what they would like to eat. Same thing, where does it hurt? If a learner sustains some type of injury, they can use the fan to identify the area of concern. So by extension, visual props are also effective for learners to express themselves. According to research from Benny in 2020, visual supports help with learning, retaining information, communication, and expression. It's extremely important for students that have autism. The next disability that we're going to talk about is communication disorders. According to the American Speech Language Hearing Association, a communication disorder is an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbol systems. A communication disorder may be evident in the processes of hearing, language, and or speech. So we know that is how we are able to get things done through communication. And one of the phrases that I always use with my personal students is, a closed mouth doesn't get fed. So if you're not able to communicate, how are we as the instructors or anybody that's in charge of taking care of you, how are they supposed to know what's going on? Communication disorders can be mild or profound. They can be acquired or developmental. It includes speech, language, hearing, central auditory processing disorders as well. So it's not just the speaking aspect, it's also the listening aspect. How does this affect learners? We're always going to come back to that question when looking at these disabilities. Well, human behavior and interaction requires communication skills. Because all communication disorders carry the potential to isolate individuals from their social and education surroundings, it is essential to provide help and support as soon as a problem is identified. What we will find with most of these disorders is that early intervention is key, okay? This disorder translates beyond educational settings and affects both children and adults alike. So this also translates to the workspace, because with my program in New Jersey Youth Corps, once the student has accomplished the goal of earning their high school diploma, they will transition into either post-secondary schooling through a college or trade school, or they might go directly into the job field. So being able to communicate on your job is pertinent for success. So the solution, we're always going to be solution-oriented when looking at these disorders. We can look at speech language pathology services. How do these services support learners? Well, speech therapy can treat a broad range of speech and language delays and disorders in children and adults. With early intervention, speech therapy can improve communication and boost self-confidence, which is very important, because if a student is struggling with their speech, it definitely has an impact on their self-confidence. Even asking students to read out loud in class sometime is a bit of a chore, because students might feel self-conscious in the way that they communicate or how they speak and how they read. Potential outcomes, which are important when we look at these disorders. In research from Broomfield and Dodd in 2011, an average of 6 hours of speech and language therapy in a 6-month period can produce significant improvement in performance, and it has been shown to be more effective than no treatment over the same 6-month period for children with primary speech and or language impairment. Communication disorders are something that can be a lifelong challenge for some learners. What is an example of how these services are delivered? Well, speech therapists can use fun activities from vocabulary games to board games and beyond to help their clients practice language production. From Greenwood in 2022. The articulation app, for example, by Little B Speech, is designed for kids ages 4 and up. The app offers practice at the word, sentence, and story levels. It features 6 activities, including flashcards, matching, rotating sentences, unique sentences, and 2 levels of stories. And the reason why I like this solution is because if a child or a learner has a tablet at home, that means that the work on their disorder can continue beyond the classroom door. So this is important, because families need to be involved in helping the learners with their disorder. This is not just placed on the school, the admins, and the therapists. Parents and family members should also be involved with helping to improve communication. So this is something that can take place at the home as well. Learners will work on improving a variety of communication skills such as word finding, speaking in turn, sentence fluency, listening exercises, pronunciation practice, and more. So that's also through speech language pathology services or working with a speech therapist. And the picture that we're looking at right now is advertising that app, the articulation station that I was talking about, and you can try it out for free, okay? Download it on the App Store. So once again, this is something that parents can utilize to help their students become better communicators. Additional support methods for communication disorders are also involving assistive technology, also known as AT. So according to the Center for Parent Information and Resources, assistive technology can also be very helpful to students, especially those whose physical conditions make communication difficult. Each student's IEP team will need to consider if the student would benefit from AT, such as an electronic communication system or another device. AT is often the key that helps students engage in the give and take of shared thought, complete schoolwork, and demonstrate their learning, because now they have that assistance that will help them to get their point across, okay? And once again, it'll cut down on the self-consciousness that students feel when they know that they have a disability, okay? There is also low and high assistive technology, which provides variety, flexibility, and options for home and school usage. So now we're going to move on to physical and sensory needs. According to the Virginia Department of Education, sensory disabilities can involve any of the 5 sentences, but for educational purposes, it generally refers to a disability related to hearing, vision, or both hearing and vision. Sensory disabilities affect access to visual and or auditory information. Most content information is presented visually and or auditory in the classroom. So that comes directly from the Virginia Department of Education guide. And it's true. That is how we present information, either visually or auditory as teachers. In research from teaching students with disabilities, there are many types of physical disabilities, including mobility-related disabilities, health and medical disabilities, and disabilities that result from brain injuries. Physical disabilities may affect someone's ability to stand, walk, sit, or move around. Some physical disabilities are episodic. They can flare up and then go through periods of remission. And that comes from teaching students with physical disabilities in 2017. So one thing to make note of is that some disabilities are not always visible. As educators, we must be empathetic towards all of our learners, regardless of their needs. So how does physical disabilities and sensory disabilities affect learners? Well, if a student has a physical disability, they might have difficulty writing, such as class notes and on exams, sitting in a standard desk, participating in labs where lab tables and equipment are hard to reach. Transportation. I have students that walk to school. If a student has a disability and they can't walk, then that's going to present a problem. Classrooms are buildings that are not wheelchair accessible. Learners with sensory disabilities may not be able to see, hear, and react without some level of impairment. This disability can vary from mild to more serious. For example, a learner might not be completely deaf, but they might be hard of hearing and they need some type of hearing aid. Autism spectrum disorder can also function as a sensory disability. Students with autism might have physical and sensory disabilities as well. So sometimes the disabilities do coincide with each other. What are we going to do? What is our solution? Well, we can look at occupational therapy as one solution. In research from Finland, occupational therapy is a branch of healthcare that helps people of all ages who have physical, sensory, or cognitive problems. OT can help them regain independence in all areas of their lives. In addition, according to Finland, occupational therapists help with barriers that affect a person's emotional, social, and physical needs. To do this, they use everyday activities, exercises, and other therapies. So OT also known as occupational therapy, is a possible solution to physical and sensory disabilities. And in here, we're looking at a photograph that shows us a day in the life of an occupational therapist. Okay, and this comes from the balance. First and foremost, an occupational therapist has to review patients' medical history and assess their needs. So all of these disabilities do not come without some form of assessment. Then they develop treatment plans for patients with specific goals, because all learners do not have the same needs when it comes to occupational therapy. And then they'll guide patients to perform tasks to meet their goals. So one learner might have 3 to 4 goals, where another learner might have 5 to 10. So it all depends on the actual learner. But that is why those assessments are so important, to find out exactly what the needs are for the particular student. AT also comes into play with these disabilities: wheelchairs, crutches, for those that have the physical disabilities, and then read aloud devices could be for students that have sensory needs, hearing aids, magnifying glass. These are things that can be utilized as a solution for physical and sensory disabilities. Example of occupational therapy: in research from Beck, using painter's tape to create mark stations for each student can be used for social distancing, but it also can help kids work on personal space, pardon me, body awareness, and spatial awareness. Students can carry these skills over to functional tasks such as standing in lines in the hallway, or getting on or off the school bus, or in the community. So that quote comes from Beck. Potential outcome for utilizing occupational therapy is through an understanding of the impact of a disability. Occupational therapists work to improve a post-acute patient's ability to function in everyday life. So their job is to make sure that the learner has some sense of independence to be able to function on their own or with assistive technology. So that is one of my solutions for physical and sensory needs. It's occupational therapy. Next, we're going to look at emotional or behavioral disorders. Okay, according to research from Lovelace, emotional and behavioral disorders is an umbrella term under which several distinct diagnoses, such as anxiety disorder, manic depressive disorder, oppositional defiant disorder, and more, fall. These disorders are also termed emotional disturbance and emotionally challenged. According to the Individuals with Disabilities Education Act, better known as IDEA, children with emotional and behavioral disorders exhibit one or more of these 5 characteristics. Number 1, an inability to learn that cannot be explained by intellectual, sensory, or health factors. 2, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers. 3, inappropriate types of behavior or feelings under normal circumstances. 4, a general pervasive mood of unhappiness or depression. And 5, a tendency to develop physical symptoms or fears associated with personal or school problems. There can be more of these that fall under what is called an emotional or behavioral disorder. Now, I have some experience working with a population of learners that suffer from these disorders. And I will tell you that it takes a lot of patience. But with patience, you can successfully work with these learners as well. So what are some of the things that affect learners that have emotional behavioral disorders? This is a list of different issues that can affect them academically and socially in the classroom. So fear, depression, stress. I know for my program, there is a lot of fear when it comes to students taking the test to earn their high school equivalency. Now, they automatically have the anxieties because sometimes they don't prepare themselves well enough in terms of studying, but there's also a fear of success, believe it or not, where learners that I've worked with prior have little to no expectations of them from their families or social circles while they are in the process of obtaining their high school diploma. But once they earn their high school diploma, the expectations from their families in particular will rise to a point where a student feels uncomfortable. Now there's these expectations. You got your high school diploma, what's next? Are you going to go get a job now? Are you going to go to school? We've had students that because they have a fear of success, sometimes they will go into hysteria or give us extreme behavioral problems because they don't want to possibly meet the next level of success. So it's like they almost self-sabotage themselves, okay? And then it's just the general anxiety that a lot of students have when it comes down to test taking. A lot of my students do deal with depression and they don't even know what that means. They almost normalize having a bad mood. So this is where our counseling services come into play to let them know this is not a way that you should live your life. You shouldn't be stressed out all the time. Now, there are other issues, mental disorders, schizophrenia that we don't deal with as much in my program, but some of these other things are commonplace, not just to my program, but for instructors that work with students all the time. No matter what age of the students, they deal with some of these things. So it definitely affects learners in a negative way, if not solution-based, right? So we're looking at cognitive behavioral therapy as one solution for emotional or behavioral disorders. According to research from the Community Guide, school-based cognitive behavioral therapy programs help students develop strategies to solve problems, regulate emotions, and establish helpful patterns of thoughts and behavior. Trained school staff or external mental health professionals use therapeutic approaches outlined in an intervention protocol to engage with students in individual or group settings. So this is what we have done in our program. We've invited mental health professionals to come to our students to do one-on-one conversations and also to have group setting conversations as well. One thing that I note is that is it essential to understand that these disorders and the solutions are not one size fits all. The one crucial aspect, as I mentioned before, is the assessment process. From there, educators, administrators, and families alike should all work together to create a comprehensive plan. Okay, it takes a village. It really does to help a learner reach their full potential. They need to feel like everybody's invested. One illustration of cognitive behavioral therapy is using a mindfulness technique. According to Shaikh, mindfulness focuses on disengaging the person from their constant negative thoughts and paying attention to the present. I have students that do this very often. So I have to always redirect. I have to constantly redirect my students' negative approaches into something more positive. If they got an answer incorrect, I focus more on their train of thought and why they got the answer wrong instead of just correcting them. Okay, so I can say, I can see how you made that choice, but let's see if there's a better answer. So that way they don't feel as if I completely shut them down. I try to understand their train of thought because sometimes a student is very close to what the answer might be. And when you understand their train of thought, you can understand why they came up with that answer. So that way it doesn't invalidate their thinking process. It's just like, okay, you're there, but let's see if we can find a better answer here. Okay, and then they feel better about themselves because they feel like they're doing the work, and they are doing the work. Another example of utilizing cognitive behavioral therapy can include graded exposure assignments. According to research from Shaikh in 2021, exposure is a type of CBT technique that helps people get systematically exposed to what triggers fear or anxiety in them. So this is another personal example. As an instructor, I know one of my students struggles with algebra. He gets very nervous on the second step of multiplying fractions, which is when you have to multiply the denominators. So I can use graded exposure to recognize and reinforce the step of the problem that gives that student the most anxiety. Because I'll say, well, where do you get stuck at? And once they're able to identify, it's right here where I get stuck at, okay? Then I can focus on that and let them know that this is not a big deal. Multiplying denominators is not that hard. Once a student is exposed enough to the second step, which is multiplying denominators, he becomes less anxious about doing the step independently. So to reinforce that, I could create a worksheet for the student that strictly focuses on multiplying denominators and let them do that over and over again, because practice makes perfect. Now, when they see that problem as a whole, they won't get nervous about that second step because they practice multiplying denominators so many different times. Potential outcomes when utilizing cognitive behavioral therapy on emotional behavior disorders and research from Shaikh. Typically, cognitive therapy involves 45 to 60-minute sessions every week for 3 to 6 months. According to research from Pell, cognitive behavioral therapy is a technique that is highly engaging and a technique that offers quick results when compared to standard psychotherapy. CBT helps us understand that we have the power to change things. CBT tells us that external situations, interactions with others, and negative events are not actually responsible for our poor moods or problems. The truth is that our own reactions to events and the things we tell ourselves about those events are most likely the cause, right? I personally love this technique because it helps our students become more accountable. It puts a mirror on them and gives them the opportunity for self-reflection. It provides learners with the onus of control. You are the person that's in charge of what you need to do. To quote a line from the poem Invictus by William Ernest Henry, I am the master of my fate. I am the captain of my soul. And we have students memorize that poem during their orientation period because we want them to lean on that for motivation as they're going through this process, so that they understand that, yes, there are things that might affect you, but ultimately you are the person that's responsible for making a better you. And when I challenge students with that, 9 times out of 10, they rise to the occasion. They do. Intellectual disabilities is the next thing that we're going to focus on. According to the American Psychiatric Association, intellectual disabilities involves problems with general mental abilities that affect functioning in 2 areas. So we have intellectual functioning, such as learning, problem solving, and judgment, and then adaptive functioning, which is activities of daily life, such as communication and independent living. So if any of these 2 functions are affected, it can definitely stop our students and our learners from living the best life that they can. This disability can affect learners in several ways. A significant concern for me is how vulnerable this condition can make students. For example, with judgment, a learner may not make good choices when it comes to decision making, and they might not fully realize the consequence of said choice. An assessment is required to find out what type of functioning is affected. So once again, assessments to find out how mild is this disability, or how severe is it, this disability? Is it intellectual or is it adaptive? Assessments will help us with that. How do intellectual disabilities affect learners? Well, according to the CDC, these are possible symptoms of an intellectual disability. If a child is sitting up, crawling, or walking later than other children, if they're learning to talk later or having trouble speaking at all, if they're having a hard time remembering things, having trouble understanding social rules, it could be a sign of intellectual disabilities, having trouble seeing the results of their actions, and then having trouble solving problems. So as we can see, these symptoms would make it challenging for a student to progress academically and even socially. I mean, if somebody has trouble seeing the results of their actions in the social situation, that could be detrimental, you know, as a whole. So these are what we're focused on in terms of intellectual disabilities. So possible solutions. I want to try discrete trial teaching, or DTT, particularly with communication, okay? Because I think that a question that we should ask all of our students, is everything okay? And we can start from there. So if our student can at least talk with us, then we can get down to what the actual issue is. DTT is based on applied behavior analysis. It involves breaking skills down to their most basic parts and teaching those skills to children step by step. Children get rewards for all their achievements, which encourages them to learn. Now, DTT is most commonly used for autistic learners. However, intellectual disabilities do impact communication skills. And according to research by Raising Children, 2021, DTT can have a positive outcome on the following: speech and language skills, like those needed for having a conversation, and skills needed for sign language or communication devices. So I always say to my students, once again, a closed mouth doesn't get fed. We got to be at least able to just have a conversation, right? And sometimes I get one-word answers from students. Are you okay? Yes. Is everything good? No. So I need a little bit more. So I would try DTT, okay? For example, let's see this in action. If a learner is struggling with communication skills, an instructor can break down said task one piece at a time while rewarding the learner for skills gained. It could just be as simple as me asking, how are you? And if I'm not getting a response, maybe I add a prompt. I might wave, hey. Then the learner will respond, I am fine, or I'm not fine. But the response is positive. Just the response alone, even if they tell me I'm not okay, then at least I know that. I can work with that. If the learner doesn't quite understand or react, perhaps me as an instructor, I can tell the learner how I feel. Say, hey, I'm feeling great today. How about you? And maybe that will elicit some type of response. An instructor can then give a reward while giving the learner time to process during the inter-trial interval. So I don't have to give a reward of $5 or, an item to a student. A reward can just be verbal. Okay, that's great. Glad to see you today. Those can also be rewards to let the student know that I'm positively responding to how they feel. If they say that they're not having a good day, then maybe the next question from me can be, well, what can I do to make your day a little bit better? Or is there any way that I can help? So I like DTT for conversational skills, for basic conversational skills, because I have students that don't talk at all. So it's hard to even get a couple words out of them. So this, I feel, would help me as an instructor, okay? So according to Applied Behavioral Analysis, this is a graphic that they had on their website, and it breaks down the 4 components of DTT: acquisition, fluency, maintenance, and generalization. So now I want to take that same conversation that I started on that last slide with that student, and I want to apply it to these 4 processes. Okay, so let's apply the DTT process to the previous scenario between an instructor and learner practicing conversation or just having a conversation. This can lead up to the potential outcome, which is the learner becoming more confident and comfortable in their abilities. Now, my student feels more comfortable sharing things with me, okay, because I'm opening up and I'm having a conversation. So acquisition, okay, this is the first part that the student has to pick up. Learner can engage in opening dialogue of conversation, responding to, hi, how are you, from a teacher, learning an appropriate response. So I can tell the student, hey, if I ask you that, you can tell me you're doing good or you're doing bad, okay? And now they know appropriate responses to that question. And once again, just because they're feeling bad doesn't mean that that's not an appropriate response. It is, because they're telling me how they feel. And then as the instructor, I need to respond to that and find out why they're feeling bad, if they're willing to share. So on the fluency level, okay, that student that was a little bit hesitant to answer my questions before, now that they know a positive way to respond, they feel more comfortable in responding correctly to, hi, how are you? Okay. Now with maintenance, maintenance is the next level after fluency. A learner can express how he or she is on a daily basis now when I'm asking them. So now this is not just one day of me asking them how are they doing. Now every day I can ask them how are they doing, and they can give me an appropriate response. And then generalization is the final level where the student has taken this conversational piece and they can apply it in different areas of their life. They might even flip the question that I asked them, and they might ask me the question. And this has happened where if I ask a student enough times how they're doing, sometimes I say, Mr. Bailey, how are you doing today? I'm like, oh, okay, that makes me feel great that a student cares about how I'm doing, right? The learner can also apply those openings to other scenarios at home. They might go home and ask their mother how they're doing, or if they have a job, they go in and ask a coworker how they're doing. And they're able to respond appropriately to those same questions presented to them by anybody, not me. So if their boss asks them a question about how they're doing, they can respond. Or if their parent or guardian asks them a question, they can respond appropriately. So that is one of my solutions for intellectual disabilities. Okay. Final thoughts. They cross out the upper part. It takes a special kind of person to care for a child with special needs. We can replace that and say a child with special needs will inspire you to be a special kind of person. And for my learning theories class last year, we had to come up with a learning theory, a personal learning theory of our own. And mine was care, concern, and connect. I think it passes all barriers that could be there for instructors to connect with their students. Care, concern, and connect. When you show a student that you care about them and that you're concerned about what's happening with them, I believe that it forms a connection, regardless of if learners have disabilities or not. We as instructors have to let our students know that we care, that we are concerned, and that's how we will make that connection with them. I also want to end off by saying, and I think I said this earlier in the presentation, these are just possible solutions. There are many other solutions to these high incident disabilities. But once again, trying out different solutions and knowing that it's not a one-size-fits-all situation is also very important when tackling these challenges. Thank you for your time.